In this lecture, we're going to review the first two of what are three successive phases involved with the drug effect. And the first phase is termed the pharmaceutical phase. And this is a phase that covers the change in the physical state of the actual drug after it's administered. And that change in the physical state takes place as the drug migrates through different parts of the body. If we take a look at solid drugs, either in pill or in capsule form, we know that for the tissues to obtain the medicinal ingredient in the drug, the solid must undergo disintegration, and following disintegration, which is a breakup of the chemical bonds holding that structure together, it can then dissolve within the cardiovascular system and then move to the tissues that will use that drug. Now, this only applies from a solid to disintegration to dissolved state, only applies to orally administered drugs. If we take a look at drugs administered in liquid form, this obviously will dissolve faster within human fluids. And that's because the step from moving from a solid to the disintegration stage is eliminated. And as it dissolves much faster, that will lead to faster absorption. And just as a review from the previous lecture, we see two over-the-counter commercially available drugs, and where the aspirin is referring to the brand name of the company that made this product, which is Bayer. And this is, we don't see the generic name. The generic name is hidden by the red line here, but that's acetylsalicylic acid. And this is delivered in tablet form. On the left-hand side here, we see children's cold and flu Advil, made by Pfizer. And again here, Advil is the brand name for the generic drug ibuprofen, and this comes in liquid form. The second phase of the drug effect is what's called the pharmacokinetic phase. And this is the phase that begins to examine the effects of the human body on the drug rather than the effect of the drug on the human body. Remember that when a person takes in some drug, that drug will undergo some sort of change by the person's physiology before the drug can exert its effects. Some drugs are much faster, of course, than others. And the pharmacokinetic phase is made up of four phases. The first phase is the absorption phase. And in absorption, the drug must pass from the mode of delivery and get into the cardiovascular system. So in terms of orally applied or orally administered medication, the oral medication must move through the gastrointestinal tract, and there are multiple sites at which following dissolving that the drug can move into the cardiovascular system. It can move through the oral mucosa, or from the stomach, or the small intestine. But orally administered drugs must go through what's called first pass liver metabolism. The portal circulation between the digestive system and the rest of the circulation must go through the liver first. And so as that occurs, the liver will carry out one of its functions, which is detoxification of the blood. So some of that medication will be metabolized. For medications that are delivered through the pulmonary system or through the skin as an intravenous, which is going to go directly into the blood, or intramuscular, those modes will bypass first past liver metabolism. The second stage here is distribution. And once we get the drug into the cardiovascular system, then that drug will circulate throughout the body. But there are some factors that will affect that distribution. Some of the factors relates to the ability of the drug to bind to plasma proteins. And once that drug is bound to a plasma protein, the drug is considered inactive. Blood flow that we'll talk about in this lecture is also another factor that can influence the distribution of the drug to different tissues in the body. The third phase of the pharmacokinetic phase is metabolism, and that's where the body, which includes the small intestine, the liver, and other organs, will metabolize the different elements in that drug before the drug can exert its medicinal effect. And the fourth and final phase of pharmacokinetic is excretion, in that there is a certain amount of that drug that will be excreted from the body through a number of different mechanisms, as you can see here, through urine, feces, expired air, sweat, as well as breast milk. Some of the factors that will affect absorption, and this is only specific to oral administered drugs, include the drug acidity. And so depending upon the pH of the drug, that will determine how well it absorbs into the cardiovascular system. The blood flow to the digestive system will also influence how much of that drug is absorbed from the digestive into the cardiovascular system, as well as the ingestion of food. In some cases, food can assist with absorption of the drug. In other cases, food can interfere with absorption of the drug. Bioavailability is a term that is a common term that refers to the percentage of the orally administered drug that enters the cardiovascular system. When we take a look at drugs administered through intravenous, as you can see illustrated in this picture on the right-hand side. So here we have a catheter placed within a superficial vein on the dorsum side of this patient's hand. That drug administered through this line here will go directly into the cardiovascular system and is considered to be 100% absorbed. Orally administered drugs obviously have less than 100% absorption. In terms of distribution, distribution refers to the movement of the drugs to the target tissues once those drugs make its way into the cardiovascular system. And one mechanism of transporting drugs is by chemically binding to plasma proteins. The most abundant is a protein called albumin. Now, it's important to know that while that drug is bound to albumin, it is considered to be inactive until the dissolved drugs in plasma will leave plasma and enter the target tissues. Another common term that you will see is something called the half-life, or T1/2. And the half-life is a measure of time, and it's the time that it takes for 1/2 of the drug concentration to be eliminated from the cardiovascular system. So when we talk about a drug being eliminated from the cardiovascular system, the drug is either excreted or absorbed by tissues. The ideal of hopefully here that the tissues will absorb the drug, but it's also important to know that we'll discuss here on the next slide that drugs are also excreted as the final phase of pharmacokinetic. And excretion just refers to elimination of the drug from the body. The major route of elimination is through the kidney. One of the key functions of the kidney is that the kidney functions to clean the blood. And in cleaning the blood, the kidney uses three fundamental mechanisms. The first stage of those mechanisms is what's called filtration. And the kidney will eventually form urine by initially filtering various molecules from the blood, and that represents the major route of drug elimination. Now, the amount of the drug excreted through the kidney can be reduced depending upon how much of that drug and how strong that drug binds to plasma proteins. And kidney disease is another important consideration in terms of drug elimination. A person that's afflicted with kidney disease may see either an increase in drug elimination or a decrease in drug elimination. So the pharmacist, in consultation with the patient's physician, will need to modify the dosage of a particular drug in the event that the patient has some type of kidney disease. Other routes of elimination include bile, which is reabsorbed from the digestive system, feces, sweat, and saliva. An interesting story, and I provide the link here to a video story published back in 2014 by the CBC, is a story where scientists are beginning to discover trace amounts, but measurable amounts of various medications in our water supply, and is starting to show up in drinking water. Because of the fourth phase of the pharmacokinetic phase of eliminating drugs, which is natural through the kidney, eventually a person's urine will show up in the water system and will eventually can start and is starting to show up in our water supply. Now, in terms of the effects of exercise on blood flow distribution, this is important to understand how this will affect drug delivery and potential absorption by tissues. So in this graphic here, we'll start at the very bottom. Here we see under resting conditions, an average cardiac output for an adult is approximately 5 liters of blood that leaves the heart per minute. Now, where that blood goes, that blood is distributed among various organs in the body. So just some examples here. Here we see the digestive system, which includes the accessory digestive organs. Under resting condition takes about 1/4 of all the blood coming from the left ventricle. And we see various percentages that go out to the brain, bones, kidney, skin, and skeletal muscle. Now, on the other extreme, with very heavy exercise, cardiac output can go up 5 times. It can jump from 5 liters per minute up to as high as 25 liters per minute. But the percent of that blood flow going out to different tissues will change here. And so what we see is that there's a sharp decrease in blood flow to the digestive system from 20 to 25% down to 3 to 5%. We see that the kidney percent decreases from 20% down to 2 to 4%. And if we jump over here to skeletal muscle, we see that blood flow increases considerably from 15 to 20% up to as high as 80 to 85%. So the cardiovascular system is a very dynamic system that can alter blood flow to tissues as needed with exercise. So to summarize the effect of exercise on drug actions, as it pertains to oral medication, we see that there is a decrease in blood flow to the digestive system with exercise. Blood flow does not stop, it just decreases. And as it decreases, that will tend to have the effect of slowing the movement of the drug from the small intestine and stomach into the cardiovascular system. So potentially a person that is exercising following the administration of a drug could potentially result in a decrease in the medicinal ingredient delivered to tissues. With transdermal medications, such as a nicotine patch, we would see the opposite here. Because during exercise, there's going to be an increase in blood flow to the skin. There's going to be an increase in blood flow to the skin because one of the major functions of the skin is to dissipate heat generated from contracting skeletal muscle. Because of that increased blood flow, there would be an increase or faster absorption when it comes to transdermal medications. And that can be problematic because it can cause unexpected side effects if the prescription dosage is intended to be applied under resting conditions. In terms of drug metabolism and distribution, it's important to know that the liver is the main organ that will metabolize drugs. And so prescription medications or over-the-counter medications are so dosed and establishes the guidelines, understanding that in the average adult, the liver will function to detoxify the blood. Now, during exercise, there's typically a decrease in liver blood flow. As a result, the drug, if administered before exercise, would tend to stay in the cardiovascular system for a longer time as the blood flow to the liver decreases. And so that would lead to a greater effect in an acute situation. And so the acute situation is during the actual exercise bout. Now, exercise training, so as a person engages in regular exercise habitually, under resting conditions, there would be a greater flow of blood through the liver as an adaptation to that exercise training. But as more blood flows through the liver, theoretically, that would lead to greater drug metabolism, and that would result in a lower effect, a lower medicinal effect of the drug on the person's physiology. In terms of drug elimination, we do see a redistribution of blood away from the kidney while a person is exercising, so during the exercise bout. And recall that the kidney is the major organ of filtration. It doesn't detoxify, it cleans the blood by allowing molecules to move from the blood into kidney tissue. But if that blood flow is decreased, that will result in a decrease in drug clearance. And that is something to certainly be aware of when prescribing exercise, is to know if your client or your patient has just received some type of drug administered, and whether there is an interaction with that drug and exercise. So this ends our part 2 of our Unit 2 lecture.